everybody, this is Dr. Daniel. Today I'm talking about what is Rebound, Congestion, and Rhinitis Medicamentosa. Nasty problem. Nearly everybody gets a cold or even the flu every now and then, and sometimes we get a sinus infection with green, yucky nasal mucus and headache. The incidence of allergic rhinitis, or hay fever in the United States for adults and children, is 10 to 30%. Allergic rhinitis produces clear nasal fluid, sneezing, itchy eyes, and nasal congestion. So, most of us use oral pills or decongestants to treat these symptoms, but then sometimes we see an Afrin ad at the drugstore and we buy that and start using it without knowing that we're now riding with the wind with a very dangerous and nearly addictive drug that can produce rebound nasal congestion and rhinitis medicamentosa. So what is this? Rhinitis medicamentosa, which is nasal spray addiction as a result of rebound congestion, is caused by the prolonged use of Afrin or other over-the-counter decongestant nasal sprays. The condition is caused by extended use of tropical decongestants such as oxymetazoline, phenylephrine, oxalometazoline, and naphthozine nasal sprays, and oral drugs such as sympathomimetic amines and 2-imidazolines that constrict the blood vessels in the nose. The active ingredients in these sprays is a topical vasoconstrictor that temporarily reduces the size of the nasal turbinates, opens the nasal airway, and provides decongestant relief from the rebound congestion. But after using the drug for 5 to 7 days, it causes rebound congestion, a miserable nasal type of suffering with a severely stopped up nose. When the nasal decongestants are used for more than 3 consecutive days, it provokes this condition called rebound congestion. And rebound congestion is the result of an abnormal swelling and enlargement, hypertrophy of the nasal mucosa, which blocks the nasal airway completely, and it causes extreme discomfort. This rebound congestion is temporarily relieved once again by the administration of another dose of Afrin or any other kind of nasal spray. And as soon as the temporary effect of the last dose of the spray wears off, the swollen nasal mucosa again blocks the airway, and another dose of spray is required to provide relief. The commencement of this cycle represents the initiation of the addiction, which can last a lifetime for some folks. Because the nasal spray itself is the root cause of the problem, the only effective way to eliminate it is to discontinue the use of the sprays. As any person that has discovered and suffered with rhinitis medicamentosa will tell you, this is much easier said than done. Breaking this addiction is not simply a matter of willpower. The ability to breathe comfortably is essential to normal human functionality. Only less than 4% of these persons are able to endure the misery associated with cold turkey nasal spray withdrawal. These affected persons are not able to sleep, eat, or work comfortably. Many of them just go back to taking their Afrin to not be in such misery. Many of these people state that nasal spray addiction is the most miserable and frustrating problem they've ever dealt with. Well, how do physicians treat this? So in search of an answer, many of these patients turn to their doctors for help in ending nasal spray addiction. And that usually would be an otolaryngologist or an ear, nose, throat doctor, ENT. Rhinitis medicamentosa is a very frustrating problem for physicians to effectively treat. There are no FDA-approved drugs nor therapies specifically for treatment of these patients. Most commonly, they're given a course of intranasal and/or systemic steroids and are told to discontinue their use of the decongestants. In some cases, surgery to reduce the turbinates or to correct a deviated septum is performed. Regardless of what treatment is prescribed, the cornerstone of the therapy is always the same. Patients must discontinue their use of the sprays. It's this aspect of the treatment that presents the problem for these patients. Patient has to get off of the offending nasal spray. This is best done by tapering off for over a week or two with a decreasing dose of the chemical nasal spray and substituting saline nasal spray. It's okay to use oral decongestants and NSAIDs because they don't provide nasal congestion. Some persons use hot towels over the nose and humidifiers. So good luck if you develop this problem getting off. Please see a professional. God bless all you folks with this, and follow me on podcasts for other talks on headache and migraine.